Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. It's May the 20th of 2022, and this is another of our COVID conversations and more. This was an unusual week. In addition to the regular COVID stuff, which we'll talk about, there are 4 other big topics that we'd like to go ahead and talk about today. So if you have questions, please send them to us at COVID Conversation at Facebook questions at douglaspublichealthnetwork.org. That's Facebook questions at douglaspublichealthnetwork.org, and we'll get to them. Last week, we had a question from someone who said, look, I looked at the breakthrough in infection data in Oregon, and it showed that about half the infections were in people who had vaccines, and that the other half were in people who didn't have vaccines. It looks like the vaccines don't work. Great question, and it's a matter of math. So there's about 75 to 80% of the people in Oregon are immunized, which means that there's 20 to 25 that are not immunized. And so that half of the cases are among the 75 who are immunized, and half the cases, the 25 who are not immunized, suggesting that the vaccine is about 60 or 70% protective. And that's exactly what it looks like. So you would expect in a population that's highly vaccinated that you will still have some cases among the vaccinated, but that the proportion of cases is going to be far greater in those who are unvaccinated. So thanks for that question. Well, COVID this week has been busy. In the world, the number of cases is about flat, with a decreasing number of cases in most parts of the world, except in North America, where we're certainly seeing a surge. There are places in the world that we're not exactly sure about. North Korea reported some cases this week. I don't believe much of what comes out of North Korea. And China has been very quiet about what's going on with COVID in China. They've had some big outbreaks in some big cities, and they've suggested that they've quelled those outbreaks, but that seems so unlikely given the infectiousness of the BA1 and BA2 variants. Nonetheless, in the other parts of the world that do have pretty good reporting, the number of cases is considerably down. And when we look in Asia, especially Australia and New Zealand, Taiwan and Japan, they're seeing a moderate number of cases, but because they have a high vaccination rate and they're getting to people quickly with antiviral treatments, the death rates are very low. In some of these areas, they're having only 1 death for every 1,000 cases. Compare that to the US, where we're still having about 2 deaths for every 1,000, for about 20 deaths for every 1,000 cases. And so we're still struggling a little bit with that. In Douglas County, we've had about 400 deaths and about 20,000 cases for an overall case fatality rate of about 2%. So the rest of the world is pretty quiet. We're really watching South Africa. As you'll remember from previous talks, they're having a little bit of a surge, and indeed they are. And it's mostly due to 2 new variants called the BA4 and the BA5, which are kind of cousins of Omicron. And we were a little surprised to see that because there were so many cases of Omicron in South Africa, and we thought that people would have good protection. But still, some of the people who got sick with Omicron are now getting sick again with the BA4 and the BA5. However, looking at their data very carefully in the last week, it looks like they've kind of peaked at a relatively low level of 11 cases per 100,000 per day. So it may be that this BA4 and BA5 may not be a big issue. We've not seen it spread to anywhere else around the world, but I think we still have another month or so until the story on the BA4 and the BA5 is written. In the US, we're seeing an increasing number of cases now at about 30 cases per 100,000 per day, so moderate range of cases. We're seeing most of those cases in the Northeast, in the upper Midwest. We're seeing some in Southern Florida, and then some in the Pacific Northwest. These cases are probably way undercounted because a lot of people are doing home tests or just not getting tested at all. And but the hospitalizations are not strongly up. So they're up a little bit, but not as strongly up as there are cases. And that goes along with the fact that a lot of people have immunity either from previous infection or from immunization. And though they may get the infection, they're not getting particularly sick. Vaccination still seems to be incredibly protective against bad disease. So hospitalizations and deaths 10 times less likely in people who are vaccinated and up to date. So please, If you've not gotten your vaccine, get it. If you've gotten your vaccine, get boosted. If you have another booster to get, please go ahead and get it. In Oregon, we're seeing an increasing number of cases, although the increase has slowed a little bit. The number of hospitalizations has slowly increased to about 300. But when we look, many of those hospitalizations are for people who are hospitalized and have COVID, but they didn't get hospitalized because they had COVID. So, for example, these are people who are pregnant and have COVID. Still important for the hospital to know that they have COVID because they don't want to spread it to everybody else. But they're not there because they had COVID. They're there because they have a baby. And so we're seeing about 300 hospitalizations a day in Oregon, about half due to COVID itself and half for other reasons. Douglas County, we're seeing a little bit of a spike. We had over 50 cases yesterday. So it's a moderate number of cases. Our hospitalizations were down to as low as 5, now up to 12 or 13 in the last few days. Again, some for other reasons, but many of those people are pretty sick. And in fact, we had a death of a young person this week. So the disease is still out there. It's still serious, causing hospitalizations and sadly still causing some deaths. But the good news is vaccines are out there and they work. We have plenty of vaccines, lots of places to get it. In addition, we've got plenty of antiviral medicines. So these antiviral medicines can either be taken orally as a pill or as an injection. And they seem to provide pretty good protection against hospitalization and death. So if you're sick, stay home. If you get tested for both COVID and flu, because we're still seeing some flu. And then if you're positive, talk to your provider about whether you should get an antiviral drug. For flu, it's Tamiflu, works well, relatively easy to use. For COVID, it's Paxlovid, which is now available at many of the big pharmacies in Roseburg. And so you could go ahead and get treated and reduce your risk of getting hospitalized or dying. So that's where we are with COVID. In terms of wearing masks, masks is real controversial, but I will tell you that for people who are high risk, you really should think about discretionary large groups. So if you're going to have a big meeting with people and it could be postponed, or you could do it virtually, that now is a good time to consider that, because we are seeing a fair amount of disease in the community. And anytime you bring a relatively big group of people together, there's going to be the chance that 1 or 2 people in that group will be positive in transmitting and give it to everybody else. So stay safe. Again, certainly no reason to panic, but I think we need to be a little more cautious now because we're in this peak. The predictions are that this peak will last another couple of weeks, and then in June will be less. So when we try and predict what things are going to be like in the future, I always look at the UK. The UK has been an excellent predictor for what's going to happen in the US. They're about 6 weeks ahead of us. They're in a very quiet stage right now. So I would predict that in 6 weeks, we'll be in a very quiet stage, which will be good because the summertime is one of the best times here in Southern Oregon. And it'll be great to be able to enjoy those things that we have. But right now we need to be a little careful. Well, this week, in addition to all the work we do with COVID, this week was just full of other things from the bizarre, like something called monkeypox. So monkeypox is a viral illness among monkeys, but can also be given to humans that looks like smallpox. You get these terrible pox, these blisters and then sores on your body. It's not very transmissible to humans. And so there's one case in Massachusetts, a few cases in Europe, and a few cases in Canada. But I don't think this is going to be a big deal right now, unless we learn something new about it. The problem is anytime you say the word monkeypox, people just go wild. So again, it's out there, but I don't think there's anything of acute concern at this time. The second thing that's out there is this acute hepatitis in children. This is a weird story. So over the last 6 months or so, we've been seeing a number of kids who have a fairly severe hepatitis. So hepatitis is inflammation of the liver. In these kids, they get sickly, they get jaundiced skin, light-colored stools, dark-colored urine, and very abnormal lab tests. This has been an important hepatitis because it's been relatively severe. A lot of kids wound up in the hospital. About 20% of the kids have wound up with a liver transplant. So you have to be really sick to wind up with an acute liver transplant. and a couple of kids have died. So relatively severe. We've not seen any cases in Oregon, but there are cases in Europe and cases in the southeast part of the country. So something we should probably pay attention to, but certainly nothing to be too worried about now. Don't know exactly the cause, although many of these kids have had positive tests for a virus called adenovirus 41. It has nothing to do with COVID, as best I can tell. So it seems to be one of those new things that's out there at a time when we're worried about a lot of other things. Well, another thing that came out this week is something called highly pathogenic avian influenza. So many animal species carry influenza. When I saw this, it was just shocking. Whales, camels, people, birds, pigs, and all of these flus are somehow slightly related. And the problem is when they jump from a species, another species to the human. So we'll remember swine flu, which started, not surprisingly, in pigs or swine, and then spread to humans. This avian influenza is now spreading among birds. This one so far has not spread to humans, and so not too big a worry. But you'll remember about 20 years ago, there was an avian influenza that we worried could spread to people, and then that could be a big problem. So this highly pathogenic avian influenza has been bouncing around the country. In the last week, they reported a good number of cases up in the Eugene area among geese, osprey. And so we know it's clearly here in the area, and we'll watch it carefully. Again, not a lot of risk to people at this point, but the concern is that just like coronavirus mutates, flu mutates, and as this influenza mutates so that it becomes more transmissible between birds and people, then we would be concerned. So nothing too much to worry about right now, but certainly pay attention. If you see dead birds and whatever, no need to pick them up and bring them back to life. Don't do CPR on the dead birds. Call ODFW and they'll go ahead and do it, and they'll check them for avian influenza. This is a special issue for people who have chickens, and lots of us have chickens, and chickens are also prone to this. And the way they're prone to this is that a migratory bird flies into the chicken pen, leaves some droppings, and then spreads it to your backyard chicken. And so that is a problem because people do get close to their backyard chickens, and there's a lot of human bird contact that way. And the concern is that it would get into a backyard flock, spread from the backyard flock to the person, and then cause disease. So again, be careful about your backyard flock. But what I want to spend most of the time today is the next issue, which is this formula shortage. And this formula shortage is absolutely heartbreaking. Lots of reasons here, lots of stuff going on here, and I'll just take a minute or so to describe the reasons. Well, it started with a factory in Michigan that was making formula, and a few babies, 4 babies, got sick with a relatively rare bacteria called Chronobacter. 2 of those babies died, and they traced it back to, they think, to formula made at this plant in Sturgis, Michigan. So they closed down the plant. Well, there's only 4 plants in the whole country that make formula, and the Sturgis plant was one of the biggest. And so now we have a relatively low supply of formula, and it's going to take that factory a while to get back in business. Now, formula is pretty tightly controlled, so we don't import a lot of formula from other places around the world, and recent laws made it even harder for us to import formula. So now, we've got this relatively low number of manufacturers to start with. One of the plants closes, and then we have a little bit of a shortage. And then what happens, and quite naturally, there's no blame going on here, is that when something's in short supply, people tend to stock up. I mean, think of what happened at the beginning of the pandemic with toilet paper. There really was no toilet paper shortage, yet people decided they would stock up on it. Then when they saw the empty shelves, they would buy whatever was there because there was this sense of shortage. So I think some of that is happening with formula. So the formula shortage is a real pediatric problem. As people may know, I've been doing pediatrics for over 40 years and know a lot about formula. So formula is a great way to feed babies. For certainly the best way to feed babies is breastfeeding, but some people either choose not to or just cannot breastfeed their babies. And then some babies have special metabolic needs like PKU, where they do need special formulas to live and survive. So this is not an optional thing. This would not be like if there was a shortage of Doritos. I mean, we could probably all go a little while without having Doritos. But for these babies, especially babies in the first 6 months, or for kids with these metabolic problems, formula is not really an optional food. Formula is absolutely critical. And there is a formula shortage. I was at the grocery store yesterday with just a few cans left on the shelf. And so we do worry about that. So what in the world can we do? Well, the government is doing the Defense Production Act. They're importing some from Europe on a special basis. They're going to work to get the plant back. But still, I think for the next 6 or 8 weeks, we're going to have a relative formula shortage. So there are two groups of kids who use formula: those who absolutely must use it, and then those who use it but don't have to. So the babies who absolutely need formula are babies in the first 6 months of life, those with special metabolic problems, and those who have allergies to other milk products. For them, formula is really critical, and we as a society should do everything we can to be sure there's enough formula for those kids in the first 6 months. The second group are kids who use formula but could use something else. And so I see a bunch of kids who are on formula after a year. No real reason ever to be on formula after a year. And so that if your kid's on formula after a year, you should talk with your doctor about switching to something else. So for after a year, you can have other kinds of milk, cow's milk, almond milk, cashew milk, all those kind of things are going to be fine. Between 6 months and a year is where actually most formula is sold. And the reason for that is that kids between 6 months to a year are much bigger than babies from 2 months to 3 months. And because they're bigger, they tend to drink more. And so many babies who are 6 to 8 or 10 months of age will be drinking a quart or so of formula a day. For them, formula is a great option. Formula has a lot of advantages. We know of all the vitamins that they need and the iron they need are in it. And so formula is a great option. And if formula is available, please use it. But for kids at that age, they can also eat other foods. And so in many places in the world, kids do not drink that much milk after 8 or 10 months. It's really just that US kind of thing where you drink a lot of formula for a long time. Really starting at 4 to 6 months, kids can start on solids, and they can increase on solids as much as they'd like. So there's really not a limit to the amount of solids that kids will take. And so if formula is low, you can certainly give kids extra table foods or ground up table foods. But especially you want to include foods that have iron in them. So baby cereal, a great source of iron, and you can do that. In addition, between 6 months and a year, well, maybe not optimal, babies can certainly have some cow's milk or some other milks. Now, it shouldn't be the bulk of their thing. So I tell parents, if kids are taking a whole bottle of something, it should be formula. But if they're taking little bits of stuff with meals, it can certainly be another liquid like nut milk or cow's milk. And for years and years and years, my advice has been that really they should have only formula in the first 6 months. But between 6 months and a year, many babies are going to start using a cup, either a sippy cup that they'll use themselves or a cup that you'll feed them, or amazingly straws. Babies around 9 or 10 months old figure out how to use a straw, and they're really good at using a straw. And so what I suggest to parents that if you're going to feed them a whole bottle of something, put formula in the bottle. But if you're going to be feeding them a cup or a straw, use milk. Use the kind of milk that your family uses. So if your family uses cow's milk or soy milk or nut milk or whatever, you can use that in the cup. And a couple of advantages of that. One is it gets them used to those things earlier, and it makes it really easy then to get rid of the bottle. So, we've all seen these kids at 3 running around with a bottle in their mouth. Just not the way it should be. So typically, if you have kids put milk or nut milk in a cup or a sippy cup, when they get good at the cup or the sippy cup, get rid of the bottle and the formula at the same time, and then you have a good transition to getting rid of the bottle. That then makes a little less frantic on looking for formula for your 10-month-old. But this is really just a tragedy in the U.S. And when I see over the last year that we've had shortages of medical equipment, almost every day we have shortage of some medicine. And it's been just crazy stuff like IV bags one year, lidocaine another year, drugs for anesthesia another year. So we just go through these shortages because we in this country maximize profits by having one factory or two factories making a critical product. And then when one of those two factories goes down for one reason or another, we wind up with a shortage. It really is just heartbreaking to see, and especially heartbreaking now to see that there's a shortage of formula. So if you have questions, please send them to me at Facebook questions at DouglasPublicHealthNetwork.org. If we have a lot of questions, we may even do a live event to help people with that. And remember, in the first 6 months or for kids with special metabolic needs, don't deviate from the regular formula that you're using. If you do need to deviate, please talk to your child's care provider. But between 6 months and a year, there are other options, and that these other options we think are safe, healthy, and in some ways a little bit better. I mean, I think being off formula and off the bottle a year, most parents are thrilled by that. Because the babies have a much better sense of mastery with a cup, and it makes it much more like they're eating at the table with you. So again, formula crisis, not great. If you have questions, send them to us at Facebook questions at DouglasPublicHealthNetwork.org. We're going to continue to follow the BA4, BA5 in South Africa. We're going to continue to follow monkeypox. We're going to continue to follow this weird hepatitis in kids. We're going to continue to follow the highly pathogenic avian influenza. So we're going to be busy over the next week, but we'll see you again next week. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you.